Hello and good day to you all from wherever you're joining us. Welcome to this webinar session. We will be discussing the impact of COVID-19 on advocacy in Africa. We will begin shortly. We will just wait for a few more minutes for others to join us, and then we will begin shortly. Thank you for joining us today. We shall begin shortly. As we wait for the others to join, kindly use the chat box to introduce yourself. Tell us your name, your organization or affiliation, and the location you're joining us from. So thank you once again for joining us and welcome to this session. We are 3 minutes past the time we were to begin. I would like to take us to the session where we will discuss the webinar norms to guide us so that we have a smooth session today. We respect your time and availability in view of the COVID-19 uncertainties. We encourage you to type in your questions and comments in the Q&A box. The panelists will use their videos and microphones. All attendees are on mute. However, if you wish to ask a question live, please raise your hand and the moderator will unmute your microphone.
Do folks feel like they've had a chance to read through, or do you need another minute? Totally fine if you want another minute.
Let's be respectful.
Just 1 minute for me, thank you. Perfect.
Sorry about that. Let's be respectful of each other's opinion. We are all knowers and keepers of information. Our hashtag for the day is #StrongAdvocacy. We encourage you to tweet and share views using that handle. At this point, I would like to take this opportunity to introduce to you Claire Mathonsi. Claire is the Deputy Director of the Advocacy Accelerator. She's an African feminist with extensive experience in women's rights and gender equality in a global context, with direct experience across Asia, Anglophone and Francophone Africa, Eastern Europe and Latin America, and the Caribbean. Throughout her career, she has worked in diverse sectors at national, regional, and global level. She has comprehensive insight and practical exposure across gender in the context of sexual reproductive health and rights, HIV, governance, economic transformation, and all forms of gender-based violence, and its linkage to key issues related to gender equality. She's the chairperson of Access Chapter 2, an organization based in South Africa. She's also the vice chairperson of Akina Mama wa Africa, based in Uganda, and the vice chairperson of Make Every Woman Count in Guinea. She's also a board member of the 1 in 9 campaign in South Africa. At this point, I would like to hand over to Claire to share with us the session agenda, but also moderate the rest of the session. Welcome, Claire.
Thank you very much, Helen. Good afternoon, good morning, good evening to all of you, and thank you for joining us today. Welcome to the Advocacy Accelerator's webinar in partnership with Global Health Corps. The topic today is the impact of COVID-19 on advocacy in Africa. My name is Claire Mathonsi, and I'm the Deputy Executive Director of the Advocacy Accelerator. And as Helen has said, I will be your moderator today. Helen, Vicky, and Anne in the chat are your accessibility coordinators. So if you're having any challenges or you have any questions, feel free to reach out to them. The agenda today will cover 3 areas: an opening, which we have mostly covered, a main presentation by Professor Bhekinkosi Moyo, and a plenary discussion where we hope you'll have a lot to ask, a lot to share, and a lot to contribute. Based on over a decade of experience and the findings from a recent SRHR landscape analysis, GHC has identified a need to focus on building the capacity of organizations working in the SRHR and the broader ecosystem. So there is shared understanding, capacity, and network to advance SRHR work. The program, which is called GHC Advancing Development of SRHR Leaders, is comprised of 3 programmatic pillars: advocacy, executive management, organizational development, and entrepreneurship. GHC has partnered with the Advocacy Accelerator to lead the advocacy pillar of this program, with a focus on strengthening local advocacy capacity and fostering greater alignment and coordination between actors in the SRHR ecosystem. There is significant alignment between both organizations, with the mission of the accelerator being to strengthen advocacy capacity, alignment, and impact in Africa by providing space online and in person for advocates, technical assistance providers, and donors and the networks that sustain them to share evidence, approaches, and expertise. Its vision is a world where strong, coordinated, country-based advocacy is a driving force for improvements in health and development. The accelerator aims to disrupt traditional models of development work and build an inclusive advocacy ecosystem that values peer-to-peer across the continent. So why are we here today? The COVID-19 pandemic exacerbated existing challenges on the African continent, ranging from inequalities to shrinking civic space. As the need for advocacy increased, many advocates faced stringent government measures that included restrictions on freedom of movement. Human rights and minority groups could either challenge such measures with all the attendant risks of taking such a stance or accept the status quo in the hope that governments would self-correct. The only possible alternative was to adopt new ways of working, one common strategy being a shift to online tools and platforms. Africa's CSOs have demonstrated resilience and adaptability in the face of pandemics, re-establishing their critical role in creating solutions in the face of adversity. The AAC, in line with their think tank role, conducted research into the impact of COVID, specifically on the advocacy sector. This was a contribution to other efforts to understand the impact on civil society, such as reports from EPIC Africa and Civicus. This webinar will explore the challenges and opportunities for advocacy in the context of COVID-19 that were revealed in the study. Not only did Professor Bhekinkosi Moyo conduct the research, but he also is presenting the results of the research today. Professor Moyo is a dear friend of the Accelerator and in his day job is a writer, researcher and thought leader who has championed the African discourse on philanthropy, contributed to the growth of many African civil society formations, and has taken part in most of the continental processes of development and governance. He is currently part of the faculty of Wits Business School in Johannesburg, South Africa, as the director of the Center on African Philanthropy and Social Investment, CAPSI for short. There will be a link in the chat for you to check out their website. They do fantastic work and they have incredible courses on philanthropy, and we would encourage you to have a look. He is the former CEO of Southern Africa Trust and the Program Director of Trust Africa. He chairs several boards, such as AROXA and Civio Institute, and also serves on several boards, such as ISTR, the Afrobarometer, AVPA, Accountability Lab, to name but a few. He serves on journal editorials such as NVSQ, Alliance Magazine, and more. He is deeply passionate about civil society, transformation, governance, philanthropy, with a strong emphasis on African philanthropy and, of course, football. We are delighted to have him engage with us today, and we believe that the experience you will have will be as valuable as it is always for us. We encourage you to post questions and comments throughout the session, as this is a space that has been created for engagement with this particular ecosystem, and we look forward to having discussions with you. So without further ado, Becky, over to you for your presentation.
Thank you very much, Claire. I'll just show my video, and if I can have the slide deck begin. So thank you for the introduction. And yeah, at times when introductions are made, one has to look at themselves and wonder whether they meet that kind of introduction. So the outline of the presentation is going to be pretty much along the lines of giving you a bit of the introduction and the context, a bit around the methodology that was used in conducting the study. Obviously, then looking at some of the contextual trends around the key constructs within the study. That's looking at civil society, looking at the notion of the shrinking space, as well as some of the trends that I think are pertinent for this discussion. We'll then look at the direct impact of COVID on civil society advocacy and pull out some of the emerging themes that I think are useful for this conversation. And then we'll go on to the conclusion. So in terms of, just to introduce the study, I think all of us here would agree that 2020 began as a normal year for everyone, but it soon became a year to reset so many things, one of which is our new ways of working, our new ways of thinking, but also, beginning to think about how we could communicate differently and advocate differently among others. And as the research paper shows, some of these things were changed overnight. And for the groups that were never prepared or had not invested in any of the thinking around pivoting, they were found wanting. But for those groups that had over time read the signs and began thinking about aligning themselves to the future of work, the COVID experience only forced them to even act much faster than they would have wanted, but they were already on that track towards pivoting to the future of work. And I think there are a couple of examples that we will draw from. So in terms of our research questions, there were a couple of things that we're interested in, and I think Claire spoke a bit about how the accelerator came into this. One, it was affected like other institutions, but secondly, began asking questions about the future of advocacy in Africa. And so a number of questions were asked here, and we tried to respond to those. So the first one is, how can an institution like the accelerator respond to the current and possibly future environments? Of course, we're using COVID as the context. The second is whether or not there have been any changes in terms of power asymmetries, particularly when looking at the advocacy environment. And thirdly, whether advocacy approaches have been affected and they have changed during this period, and what does that mean for the future? We're also looking at how donors responded to advocacy in the time of COVID, but this could also mean how did donors really respond to COVID? What were the changes that took place and what were the implications around that? We also look at what are the current needs and priorities of the African advocacy ecosystem as a result of COVID. In other words, we are making a distinction between advocacy in general and African advocacy ecosystem in particular, and whether or not COVID has given us some lens and some window into what needs to be prioritized. And then, of course, like I said, one of the key underlying themes here is the shrinking space for civil society that normally is embedded in the political economy of advocacy in Africa. In terms of methodology, of course, between March 2020 and today, there's been lots of work that has been done on the impact of COVID on different sectors. And at the time of writing this report, there were already lots of reports that had been done, but we needed to situate the study within the broader political economy and the study of advocacy and civil society. And as you would know, advocacy is really a subset of what happens in the civil society space. In other regions, we'll be talking about the third sector. In our space, we talk about civil society, but we are really referring to that sector that is between the family and the state. So anything that happens between the family and the state forms part of civil society. Some elements of the private sector also form part of civil society. So within that space, a lot has been happening over a number of years. And so the shrinking space for civil society is a phenomenon that just did not happen because of COVID-19. It was already something that was underway. We can draw from several studies, whether it's women's movements and how they have sought to really fight the struggles of oppression, inclusion, among others. We can look at it from the studies of youth and other movements and so forth and so on. And so this idea that the space was affected during COVID is not something new. But the political economy is very important in terms of understanding some of the approaches and some of the methods that were adopted by member states. And then, of course, like I said, we have lots of reports that we drew from. In particular, we refer to the EPIC Africa report that looked at the impact of COVID in 2020 across more than 1,000 civil society organizations. Another report that was very important was one that was done by the accelerator itself, looking at the impact of COVID on advocates and as well as technical assistance providers. But we also did interviews, as you can tell. We interviewed activists, we interviewed advocates, and these were drawn from East Africa, West Africa, North Africa, and Southern Africa. I must make a point that the interviews were not representative, so we don't really draw conclusions, but we can draw trends and some emerging themes out of that. So in terms of background, I think, this was really, as of March 2021, but a lot has changed in terms of, what the world looks like. As we speak today, the world has registered more than 180 million cases of COVID, with about 3.9 million or close to 4 million deaths that have been registered across the globe, and more than 164 million recoveries. But if you look at Africa, and of course, the point that we were making then was that countries were experiencing a second wave. But some of the countries right now, as we speak, are in the third wave, South Africa being one of the key countries that has entered the third wave. If we look at the numbers in Africa, a lot has changed also in terms of the numbers. As of today, we're looking at South Africa having registered more than 1.8 million cases compared to the time in March. And then we're looking at South Africa having registered more than 59,000 deaths with more than 1.67 million recoveries. And that's followed by Morocco, which is sitting at 527,000, Tunisia at 387,000, Egypt at 278,000, Kenya at around 179,000, Nigeria at 167,000, Zambia at 137,000, Algeria 136,000, Ghana at 95,000, Uganda at 73. And of course, the list as you go down becomes smaller and smaller. So I think that one of the things that is important in this background is that it was too early then to make conclusions as to why the pandemic had turned the way it had done in Africa. I still think that not a lot is still known about why other countries, especially, South Africa is a unique case. But if you look at the cases as I read them out, the other countries have registered some numbers, but they are not as big as compared to South Africa. And some of the reasons that we thought then, or some of the theories that had been bandied around, were that Africa is a youthful continent with more than 60% of its population being people who are under 25. It is possible then that, because of its youthful nature, we would not be able to record as many cases as other regions have done. And so a number of people could have contracted the virus but remained asymptomatic due to their health and fitness levels. But another reason was that Africa has experienced previous pandemics, and the majority of you who work in the health sector, you will be familiar with the Ebola pandemic as one of those examples, where countries like DRC, countries like Guinea, Liberia, Sierra Leone, among others, actually went through this experience and developed their health systems, developed their response mechanisms. Also countries like Uganda and others that had dealt with this at a community level. So in terms of community mobilization, most of these countries already had systems in place to deal with a pandemic of this nature. So that's one of the backgrounds that I think is important to consider. Now, how did our countries respond? And I think this is important because in some way, it also speaks to some of the strategies and some of the restrictions that advocates then faced. Different regions determined different measures using their legislative frameworks. And one of the things that we are trying to show here is that countries declared either a state of emergency or a state of disaster. And in a state of emergency, there are certain things that need to be done. Whether you go through parliament and get approval, you have to report to to the UN General Assembly, among others. Whereas in a state of disaster, there are certain rights that are limited, but rights are not, denied completely like you would have in a state of emergency. So you can see in terms of the countries that opted for a state of emergency and countries that opted for a state of disaster. But in reality, though, our study, and I think everyone here would agree, countries operated as if they were all in a state of emergency by restricting movement, restricting access, restricting gatherings, among others. And so you would see that in the next slide, we're talking about what did this entail. So you can see that, we had about 17 declarations of disaster recorded, about 8 of calamity recorded. We had public emergency declarations, but you also had 100 measures that were meant to curb free movement and peaceful assembly across Africa. You had about 32 imposed lockdowns at the time of writing. We have not updated this slide. We are in another lockdown now in South Africa. I don't know about other countries. We also had countries that imposed curfews. You can see at the time of writing, we had about 28 of them. We had prohibitions around gatherings, but we also had new laws that were put in place targeting what was called the fake news. And we use fake news in inverted commas here because it really depended on what each government defined as fake news. Most governments used this opportunity to descend heavily on media by using the tagline fake news. If we can, and then of course, that had impact on civil society. But what I thought was important here is to talk a bit about, what did civil society within which the advocacy ecosystem lies, what did it look like before COVID-19? And here I talk about narratives of shrinking and shifting spaces. So and I did say here that the idea of a shrinking space for civil society had already occurred, taking different forms under different contexts. And you would see that each country, would have a certain approach to how it deals with civil society. And this differed from region to region, context to context, country to country. And so COVID-19 is definitely not the major struggle for civil society. There were other struggles, and these continued even during the time of COVID. So what we can say here is that COVID-19 just added to civil society's problems or to advocacy problems. So there are waves that I think you might want to be familiar with in terms of this process. The first wave was ushered in around the year 2000, when the war on terror and the events after the 9/11 in the USA led to the limitation on the expansion of civil society formations through the introduction of restrictive financing to civil society and restrictions on other political and civic rights. And this had a huge implication for advocacy organizations. Secondly, a second wave was a response to the rise of the internet, in particular, the WikiLeaks saga that attracted sharp reactions from major global powers. And I think that's still ongoing. We can see different countries have put in place different laws and processes to deal with the growth of the internet or the Internet of Things. And then the third wave was a response to the rise of the Islamic State. And I think that, the religious fundamentalism has posed a lot of concern, but also made the situation worse for some of the civil society advocates because it's easy for governments to just lump them under that. And then, of course, these trends, I think, they've led to a number of things. The first is that governments have created legal and administrative barriers that make the operational environment for civil society very difficult. Each country here represented in this webinar has got a civil society or a law that governs the non-profit sector. And that law has been derived from, either the template that was designed in Ethiopia, designed in Zimbabwe, designed in Uganda. I'm here talking about states that have produced very cohesive laws, and those laws have been copy and paste in almost all cases in different countries. The second trend is that the shrinking space requires civil society organizations to get prior approval from government in order to receive international funding. Again, a lot of countries have laws that determine who gets funding, where that funding comes from, and whether or not you can use the funding from outside without government approval. And as we see in the report in the case of Egypt, during the COVID situation, funding wasn't such a problem in terms of the availability of funds. The problem was governments giving approval to civil society and advocates to use that funding. In other countries, of course, we do discuss about the changes in donor landscape. The third trend is that the laws and regulations, and I think I've already spoken about this, but these range from how to govern protest, the internet usage, freedom of expression, assembly, and association. All the countries here are affected by this trend. And then the fourth trend is the restriction of freedom of assembly. And I think for some reason, we've kind of explained this, so I don't need to spend the time on that. The fifth trend is the criminalization, the stigmatization, and at times, the whole process of delegitimizing human rights defenders and advocates. And then the sixth trend is the restriction of the freedom of expression, especially online. And then, of course, that was the narrative before, and I think it continues. But what did COVID-19 do to civil society? So the point we're making here is that even though COVID-19 started as a health or a medical problem, it soon became clear that its ramifications went beyond the health sector to include other sectors or dimensions of society. For example, we know that with lockdowns, food security was affected. The economy almost collapsed in most countries. Society and culture changed. Technology, among others, became the way to operate. And so there were so many changes that were brought about by the COVID pandemic. But the response to managing the pandemic had to be multi-sectoral and multidisciplinary. So some of the impacts that we noted from our study is that one, there were very limited recovery measures globally given to society as a whole, but in particular to civil society. Civil society was actually left out in all the economic recovery measures that governments put in place. And so this is one of the areas for advocates to think about. If there's to be another pandemic and governments are thinking about recovery measures, we need to get civil society and advocates into the table so that they can also benefit from that. But the second impact was that, while on the one hand, the measures were meant to protect citizens and curb the spread of the virus, it soon became a political process for most governments where they actually ended up violating human rights. And so, you can see how the pandemic impacted on institutional and operational models, as well as giving some governments an excuse to violate human rights and restrict citizens' freedoms, especially, as they relate to association, movement, assembly, and expression. It was not always necessary to restrict movement of people, but government used the opportunity to really close down the space. But also corruption became one of the biggest problems in the continent. You'll be aware that there are probably more than 3 countries that have lost their health ministers as a result of corruption related to COVID-19. The latest is here in South Africa. The minister who was leading the charge against COVID-19, and we all believed in his technical abilities, is currently on forced leave simply because there was a corruption scandal related to his involvement in some of the procurement around COVID-19. The other, I think, issue that we raise here is that the majority of people in most African countries were not equipped to adopt to a technologically driven environment, such as working remotely and adopting various digital tools, whether this related to travel, ways of working, among others. So when we look directly into civil society, and this is drawn from a couple of studies, including our own, we see that the civil society problems or the even advocacy problems that existed, they were exacerbated by COVID-19 and brought to a sharper focus. And so we then saw, a lot of organizations facing a lot of challenges around working remotely, having their budgets, either reduced or changed simply because they now have to respond to COVID-specific issues, but also having weak systems to help them to navigate and to pivot to the new terrain. So you can see that, out of this study, 98% were impacted heavily by the pandemic. Close to 70% had to reduce or cancel their operations. More than 55% lost their funding. And then, a further 66% expected to lose funding. There's a further study that is currently underway by EPIC Africa and us to actually do another study to see whether things have changed since the last survey that was done. But we also see that 50% yet to adopt cost-cutting measures. About 84% were not prepared to deal with the disruptions. And this is a major lesson for all of us. How do we deal with disruptions? Because disruptions are going to be a constant phenomenon in our lives. And 75% did not have any prior arrangements to work remotely. And 84% ended up working from home, and 74% were restricted from movement. So these were some of the direct effects that, if you looked at the broader study on civil society, you would say this was the impact that it had on civil society. But when you look now specifically on some of the issues that related to advocates, you see that about 80% said that their funding was affected, and just 5% yet their funding increased. And we will talk about why funding increased for others during this period. And about 70% redirected their funding to support COVID-19. I think the point where we want to make here is that different donors responded differently to the pandemic. Corporate donors, you would see that the majority of them moved away from their usual corporate responsibility budgets because those were affected by the pandemic, and so they responded to now doing their work differently. And so they had to do online, they had to probably emphasize more giving of in-kind goods such as data, equipment, among others, but not so much giving finances as would have been expected, except for a few groups that contributed to solidarity funds in different countries. And then, of course, the cutting of funding had a huge impact on smaller organizations, but some bigger organizations remained still functional. Some actually got some of their funding increased because they had the capacity to respond and deliver services on the ground. But one of the things that I want to make here is that, in the beginning, most countries, South Africa and others included, because of the tighter measures, it meant that civil society organizations, including the ones that had big capacity, could not do anything because they were not considered as essential services. Again, that was one of the biggest things in most countries to determine who is an essential service and who is not. Are advocates essential service providers or not? And I think that's a discussion that we need to actually have. So what were some of the risks and opportunities that were posed by COVID, for advocates? So you can see that the risks were around issues around travel bans. So if you tried traveling during that period, you risked yourself. In some countries, because you are now domiciled in one place, in your house, in your home, it was so easy now for government to actually arrest you because they knew where to find you. But also harassment, especially for those that still wanted to be involved in advocacy, and which advocacy involved going out into the streets. We know in some countries, some people tried protesting and they were harassed. And then, of course, cyber risks. Some people started, working on Zoom because Zoom was the in thing, but in no time realized that Zoom was very much vulnerable to hacking and among other things. So they had to switch to other new technologies, such as blue jeans, among others. But there were also opportunities that were presented by the pandemic. One of them is that more people actually were engaging across organizations, across countries, across regions. So the cyberspace and the online platforms made it easier for people to actually engage across organizations. But also the fact that it also made it much, much easier for power to make and take decisions. Unlike in a physical format where you would have a hierarchical structure. In most cases, the structures were almost flattened as a result of this. And then creativity, I think that, if there was a time where we saw solutions coming out of creative spaces, at times infused by technology or by other forms, this is the time that we have seen lots of innovations coming up. And so lots of, technology that has driven this creativity happened during this time. But of course, we know that during this time, the big question is the increase in gender-based violence, whether for women, for the girl child, or for minority groups, especially the LGBTQ community. We heard stories from countries such as Zimbabwe and others, where because of the lockdown measures, people had to go back to their homes. And going back to their homes meant that they are going back to people and community that did not accept them in the first place. And that was the beginning of the increase in gender-based violence. And I think everyone here could share stories of those increases in gender-based violence. Some of them are recorded officially by state institutions like the police, among others. But also the closure of offices, a lot of offices closed down, and this had a huge impact on advocates across Africa. One of the groups that we spoke to in Egypt works very closely with women victims of gender-based violence, and they provide shelter homes, among others. And during this time, because they had to close their offices, it meant that going offline had a huge impact on how they operated. And so they had to become very creative around how they still responded to the need around sheltering women who are abused. So rather than taking them to the shelter homes that were closed, they ended up renting apartments and taking those women to those apartments. So these are some of the creations and the creativity that came up during this period. So what is the conclusion? The conclusion is that COVID-19 further entrenched the culture of closing the space for civil society and advocacy included here. And this, in many ways, exacerbated the challenges that already existed, such as the lack of funding, the weak capacities, the lack of infrastructure, the weak leadership that is always in the civil society space, the limited use of technology and investment. In fact, we did survey around some organizations, and it showed us that before COVID, there were very few institutions that had strategies on the fourth industrial revolution. And in fact, not many CEOs or directors thought that was an important area to invest in. And so none of them even had taken leadership of the strategy on technology and the fourth industrial revolution. In fact, they had limited it to the ICTs unit. But this is a key and important area, because if you don't take cognizant of it as a leader of an institution, then you'll be left behind, because when the time comes to pivot, you won't be a leader in that area, and your team will not follow you because you have not led in that area. But also the fact that the repressive regulatory environment already existed, and with COVID-19, it further shrunk and became even more stricter. So the direct impacts of COVID-19 on CSOs and advocates raise a number of key areas to pay attention to. The first is, how do we measure the impact of online-based advocacy? The future of monitoring and evaluation is going to be driven in the main by technological tools. And I think this is one of the areas that the Accelerator has been working on, and I'm sure going forward is an area where they will be engaging with a number of advocates around this. The second is the question of resource mobilization. The pandemic demonstrated that there are some possibilities around local resources, and also how fast donors can change their strategies and priorities. So the possibilities were really demonstrated by the amount of giving that took place by individuals, by companies, even by governments, some of which went into solidarity funds, others went into other forms of initiatives that were meant to respond to the pandemic at a community level, at a national level, but also at a continental level. We also saw some giving coming from outside, where well-wishers, philanthropists, and others gave lots of amounts to addressing COVID, especially in the area of health and some of the PPEs, among others. But we also saw that donors responded very differently. Some donors took a conservative approach and took a wait-and-see attitude to see what will happen to the economy, and therefore did not fund anything at that point in time. They waited to see what the economy will look like before committing funding to new areas or to their existing partners. And then there were a very few progressive donors that actually took the opportunity to be creative and say, during this period, this is the opportunity to actually increase our grants, reduce the bureaucracy around funding, give our partners flexibility around reporting, but also give them the leeway to use the funding that they have and reallocate it to different lines as they see it fit. So we had huge, support coming from some progressive donors, understanding that COVID-19 presented a new way of thinking, reimagining donor-civil society relations. And I think we've got a couple of examples that we could learn from. The third area is that advocacy and leadership during a crisis period, such as COVID-19, requires what we term here liquid leadership. And liquid leadership is really around how do you lead during times of uncertainty, during times of instability? How do you lead from vulnerability positions, among others? You would know that right across the world, if we look at world leaders, the leaders that seemed to respond very, very well to COVID-19 were actually women leaders. And when studied, these women leaders emphasized that they actually operated from the position of vulnerability. And I think that's a debatable concept, but it does tell us something about how leadership is constructed and how to, what element or what part of leadership you pull on during times of crisis. And of course, I think the final point here is we're talking about designing and packaging of advocacy messages. One of the things that comes out of our research is that there are weaknesses when it comes to how advocacy relates to how messages are transmitted. So packaging and design will probably be one of the biggest ways in which we can get messages across, especially if we are to take into account that this is a new world, it's a digital world, and it offers more opportunities than the traditional world actually did. I think this is probably the end of my presentation, unless there's another slide, but I think these were the points that I wanted to raise. Thank you very much.
Becky, thank you so much for a comprehensive presentation that I'm sure has made many of us think, which is always a critical part of research. What is powerful from what you have shared is that many a time as change makers or advocates, we do not look at the broader context within which we operate. And this research and your presentation and insights has really embedded that reality that if we are involved in pushing for change, we are impacted by the different measures taken by governments, in some cases very retaliatory, in other cases just sinister in the agenda of limiting the voice of citizens engaging on their advocacy issues, human rights issues, governance issues, and right now something that's critically important, post-recovery conversations. And so thank you very much for that. There have been a number of comments and questions that have been posed, but before we go to that, I wanted to ask one question before I ask Vicky to just share some of the comments, and then we'll open up for more questions, is around the fact that time has moved on. We're now in 2021, and the fact that other reports have come out as well. And my one question was around the trends. Are there other trends that are coming out, or is what you have presented and what we're seeing from other reports the trends that are being cemented? And I'll hand over to you to answer that.
Thank you. I think in the main, the trends remain as they are, but we do have additional ones that I think are important to look at. So the first has to do with the whole politics around vaccine, acquisition, procurement, and provision. We see that there's already an emerging narrative around the differences in terms of vaccine access and provision between the West and Africa. I think, as you can tell, most African countries are probably not going to meet the targets in terms of vaccinating their citizens. We can look at the biggest country in terms of economy, South Africa. We are nowhere nearer in terms of even getting, I think right now we have not even vaccinated more than 2/3 of the population. We are still at the level of vaccinating essential workers. We haven't, I think we started looking at the elderly from 60 years and above. The entire youth population from, whatever age to like 59, they still haven't had that opportunity to be vaccinated. But also the management of vaccines in different countries is also another important question. This vaccine nationalism question that has come up is an important discussion to actually have. But I also think that people have also shifted their thinking around the pandemic. So, in 2020 and potentially beginning of 2021, we're beginning to think about post-COVID. But that's no longer the case. We're no longer talking about post-COVID. We're now talking about living with COVID, because I think it's now clear to us that this pandemic is going to be with us for another couple of years. We just have to figure out new ways of navigating and living with it. And so, having to really emphasize measures, non-pharmaceutical measures, is an important way to go, because vaccines on their own, in Africa at least, are not going to be an immediate solution. We see this in other regions. I mean, in Europe, in the US, I think we have seen the economy has been opened. People are beginning to gather, stadiums are filling up and so on and so on. So there's a huge difference between Africa now and Europe in terms of the management of the pandemic. But overall, I think in terms of the civil society and how it is affected, I was also looking at the charts. A lot of countries have gone into hard lockdowns. I've got researchers based in Rwanda which have sent me messages today saying Rwanda is actually, kind of instituted new measures that will impact on their work in terms of research and all of that. So that means it's going to impact on civil society. I'm aware that Uganda was also going through, a heightened state of the pandemic, and so they are also going through new measures in terms of lockdowns, and that has an impact. So I think the shift is on civil society adjusting itself in terms of its thinking and planning from post-COVID to living with COVID. And I think that's where we should really be emphasizing that discussion. But overall, I think, the trends have remained the same. They haven't really changed. If anything, they might actually worsen.
Thank you for that. It feeds very nicely into a question posed by Omar. And in seeing the response by governments to COVID, in many ways, there was a lot of investment in health and a lot of investment focused on the private sector. And in the health space, we saw attention in the pivot towards responding to COVID and other very necessary health needs like SRHR. And many SRHR organizations have said they were not able to provide services because some of the government regulations required them to provide COVID services. So in a sense, going forward, do you think there's going to be a tension between the health response to COVID and then priorities like SRHR and GBV, because there's an integration in the response? And I'm going to read the question from Omar so you can also add that in your response. He thanks you for your presentation and says it's informative and interesting. And he says, my question is, in fact, Omar, I apologize for saying I did not ask, but the question is, my question is, what opportunities does COVID-19 related funding provide for SRH-focused organizations in terms of carrying out advocacy work? Is pivoting the orientation of the said organizations absolutely necessary for survival, or should they persevere in what they know and do best? Fantastic question. Omar, over to you Bheki?
Of course, I'm not going to be specific to the area of health per se, but I'll give you my reading in terms of my understanding of the funding space, but also issues related to pivoting, given the situation and the context in which we live. Looking at progressive donors that I referred to, one approach that they've adopted is to look at the context holistically without focusing in particular to COVID only. Because COVID-19 is a pandemic, but it's a pandemic that is either assisted or exacerbated by ecosystems, by the infrastructure, by existing cleavages that are there. So if, for example, we don't have existing proper roads and there's a medical emergency, you need to be able to transport patients here, between here and wherever. You are affected by that lack of infrastructure. If poverty and inequality are such a big issue in your country, and then you are hit by a pandemic like COVID, that has a huge impact on the medical response, because essentially you have to take into account, what is needed for the immune system to respond. I'm not a doctor. Some of you are doctors here. You would know what the immune system requires. And a lot of that has to do with issues around nutrition, around levels of inequality and poverty. So a lot of donors that are progressive noticed that, and instead of focusing only on COVID-19, they looked at the system as a whole and said, what are the things that need attention that if not addressed, they will actually impact on COVID-19 and its resolution. So for groups that are advocating in this space for SRH and others, it means that you have to locate yourself within the ecosystem and use that as an opportunity to make an argument that if not addressed, this is the impact that it will have, not just on the resolution of COVID-19, but also on its spread and the ability to actually limit it. So if we look at a classic example around protecting minority rights, if you don't deal with that holistically, it has all sorts of implications on movement, on the ability to either put pressure on hospitals or not, because with more violence, you're actually putting pressure on the health system. But most donors might not have thought about the fact that if you don't address gender-based violence, you are likely to be aiding, pressure on the system. But if you address gender-based violence, you address global reforms that have to do with sexual and minority rights, you are in many ways also part of the fight against the pandemic. So I think it's a question of framing, but it's also a question of positioning these different, I would say, cogs within a wheel in terms of your approach to donors and among others. In terms of pivoting, whether pivoting is absolutely necessary for advocacy groups in this space, I wouldn't characterize it as absolutely necessary, but I think the new context requires specific changes or certain changes. It may not require you to change your mission and your vision, but it requires you to change your tactics and your strategies, your tools, as well as your techniques, because the new world requires a new approach. You are likely to become irrelevant if you are using tools that were meant to solve problems of yesterday. So I don't think you should change your mission or your mandate, but definitely you should look into what the implication is to your techniques, to your strategies and tactics.
Sorry, I'm choking. Apologies. It's not because of what you said.
I have a feeling you're choking because of what I said.
I'm agreeing with what you said. That's really powerful about pivoting, Becky. And I'm going to say one thing, last thing before I open up. We had a session with donors where OSF very clearly said that organizations are going to close the organizations that survive are the ones that can take the opportunities that COVID has presented. And what donors are looking for is solutions. And I also hear you saying to the group that you need to think differently, position differently, and look at the holistic picture. I wanted to dive in a bit in terms of funding. And I know CAPSI does a lot of work looking at African philanthropy and African ways of giving. You also track the corporate sector giving, but also traditional funding. And is there something you could say on how we need to think about how funding is going to be affected going forward, and how as advocates we need to be thinking if we want to continue to attract support for our work? Back over to you.
Okay, thank you very much. I think funding was affected, definitely, as you saw from the presentation. A lot of donors are thinking about how to make contributions or support that makes them, one, relevant, and to be relevant, you've got to be funding issues of the day. But secondly, beginning to think about the remnants of COVID-19. So if you are not part of the remnants of COVID-19, chances of you getting funding are likely to be very slim. So it has really called us or called upon us to change our ways of thinking around resource mobilization, around fundraising. The traditional template that we used has to change. So I see, us thinking about new areas that are likely to attract funding, and those areas are likely to be in spaces around health. Definitely health will still continue getting funding, but the question is what within health will get funding. It will definitely focus on essential services, depending on how essential services are defined in each context, but definitely it's a new flavor in terms of funding and thinking about new spaces and how new spaces are supported, taking into account the impact that COVID has had to livelihoods, but also to, just the organization of people's lives at home and in the workspace. So issues around childcare, among others, are likely to come up as potential, spaces for funding if we make lots of advocacy around that. But what does this mean for us as advocates? I think it means we need to think about, segmenting a lot of our funding streams, either into, what we consider to be traditional sources, and those traditional sources, depending on where you are located and who you are, might basically be, foundation funding or bilateral funding for most organizations. So that traditional funding will still be available, but I think it will be available in a different format. So we need to engage in what does it look like. But we also need to think about new and innovative sources of financing, which we have not engaged in as advocates and civil society. I think, for a very long time, we were nicely funded by our international colleagues, and very few groups were funded locally by either their governments or by philanthropies, or even by the private sector. But this is the time for us to think differently, in my view, and I talk about this to most of the constituencies that I work with, that we have to think differently. This is the moment for all of us to begin thinking about social entrepreneurship. Even though you're a civil society organization, you're an advocacy organization, nothing in the law, as far as I know, in all the countries, stops you from pivoting or adopting a social entrepreneurship route. So you can still remain doing your advocacy, among others, but you could have an income generating arm that you use for income generation, and you plow back the money into the mission and vision of the organization. So social entrepreneurship is one way of thinking about that, because a lot of what we do, we have developed skills and competencies in, but we have not monetized those competencies. Is it time for us to think about monetizing our skills, our competencies within the advocacy space? Secondly, how do we work closely with the private sector, knowing that the private sector benefits a lot from the global reforms that advocates are involved on a day-to-day basis. What is it that the private sector is giving back? So we need to tap into the private sector. We need to change some of their mindsets. We need to ask them to give some organizations shares. Organizations need to invest in some of the startups. They need to invest in some of the organizations so that they are able to not only direct the direction of the company, especially as it works in communities, but they are also able to benefit from a dividends point of view. Also, the high increase of high net worth individuals in the continent is an opportunity for a lot of advocates to benefit. We saw how high net worth individuals in the continent were forced, whether morally or otherwise, to actually give back to their communities during this COVID period. Why can't they do the same in non-crisis moments, especially if we take advocacy to be one of the important components in society? And I think that's an area that we need to talk about, because a lot of them don't prefer supporting civil society or issues that have to do with policy, issues that are seen to be abstract, among others. So those are some of my thoughts around this, but I really think that it's time for us to think differently around funding and how we raise resources. Let me end by saying, in all of this, you would need to raise friends, whether in the private sector, in philanthropy, or in the traditional sources. Fundraising begins with friend raising. I think you're mute.
Thank you. I was saying that is so powerful, and thank you very much for that. I do want to give Vicky, who's also one of the accessibility coordinators, to just check and share some of the comments with us. She may also have a question, but also encouraging the alumni to pose any questions. If you would want to ask a question, if you could raise your hand, you are able to speak instead of type. We will look out for that as Vicky goes through the comments. Vicky, over to you.
Thank you, Claire, and thank you, Becky. That was really useful for us. I think that what's coming out in the chat is maybe mainly two things. I think that just like what's happening in South Africa, it does seem that countries are going back down into lockdown, and especially you did mention Rwanda and Uganda, which some of the fellows have also mentioned. And we really need to think about, what is the impact of that going to be? Because I think we were getting back to somewhat normality in some ways, and now all of a sudden we're back to lockdown. So what does that mean? I wanted to really touch on something that, as we all, most people on the call are SRHR activists and workers, and I think there is an opportunity, and we really need to think through the impact of COVID on SRHR. And I think you touched on a little bit when you spoke about gender-based violence, and we know that there has been increases in gender-based violence, and that's made our work a lot more difficult. But I think that there's other impacts of COVID on accessing SRHR services, which are not always seen as essential services. And so I think that really highlights huge advocacy opportunities for organizations. And we can't go about thinking about SRHR without really factoring in how COVID has impacted on SRHR. I think that a question that I have for you is that you spoke a lot about the impact on civil society organizations, but I think that the impact has also been on human rights defenders. And I'm not sure if you could talk a little bit more about that, on how COVID has been used to further silence human rights defenders and further silence work in that area. So it'd be useful for you to, if you could just maybe touch on that a bit. I think that the last thing is coming out of the chat is that the issue of vaccines is a big one. And I think it is an area for advocacy. I know that there is some advocacy happening, but how do we sort of link into that, provide solidarity, really get that discussion and that, you know, on the agenda, so to speak. So I think that that is what people are saying in the chat. Yeah, so if you could maybe touch on some of those. Thanks, Claire. Thanks, Beck.
Okay.
Thank you very much. Go ahead, Prof. Moyo.
Thank you, Vicky. I think, you know, I would also love to hear from, you know, people on the call or on this webinar, because a lot of this is stuff that you do on a day-to-day basis. So I am really giving you, you know, trends as they are emerging in the broader context. But, you know, in relation to human rights defenders, I think this is a specific group within civil society that I kind of alluded to. It has never had it easy in any government, for that matter, because, you know, if you're a human rights defender, you are basically, you know, speaking truth to power. You are holding government to account. And in most countries, you know, human rights defenders are classified, I would say, as the enemy of the state, so to speak. So it has never been easy for human rights defenders, even before COVID. And what COVID actually did was to make their case even worse. And so you have seen that in most cases where there were limitations on human rights, where countries adopted militaristic approaches, and you had the military armed forces enforcing the measures, at times very violently and harshly. Human rights defenders would come out either, you know, hold protests or do litigation, among others. And that would obviously, you know, I don't want to say anger, but it would call for the state to also respond appropriately. And responding appropriately means either harassing them, imprisoning them. We have had cases where human rights defenders were imprisoned during this period under the pretext of violating, you know, measures. But in essence, it was really to deal with questioning of power of the state. So I think that's a big area around human rights defenders. And I think what we have seen in the past in most countries is that human rights defenders have always had strategies in place, whether it's urgent funding, where, you know, you are able to respond overnight in less than 24 hours to protecting or just getting human rights defenders into a safer space. I think that's something that, you know, from this perspective, we need to be thinking about how to even increase that, but also having some funds that are dedicated to litigation, among others, because a lot of these processes are political, but they also have a legal dimension to them. And so at times we should win in the legal space, even though we may not win in the political space. The point I'm making is that at times you can make a point without scoring a point. And so legal rules at times make the point, whereas political rules are meant for scoring points. And so how do we, you know, in many ways create a balance between that? But also, how do we use the cyberspace, the technological advancement that we have to actually work with human rights defenders? I think in the paper, I talk a bit about some of the strategies like narrowcasting, among others, which are strategies that human rights defenders, especially post the Arab Spring in North Africa, adopted in order to protect their information, but also to protect their location, to protect each other. You adopt some of these strategies such that you are not easily penetrated by the state. So I think those are some of the issues that I can raise. In terms of vaccines, I think there are colleagues who are more you know, competent to talk about vaccines in this webinar than I am. But all I know is that the vaccine process has really been politicized and commercialized to an extent that in a number of countries, it's not clear as to why populations are not vaccinated. Is it because it's purely lack of access or bungling, you know, of the procurement process, or there are basically bigger political battles that are happening behind the scenes? But I think there are people who are more competent here than I am to give an opinion on vaccines. Thank you.
Thanks so much, Prof. Moyo. We do have 2 questions and comments from people that I'm going to open up for, just to alert the group that we are deploying a survey. Please do complete the survey as we start to wind down. Before we do that, I will hand over to George Ashimwe to share his comment, and then we will go to Kwesiga. Thereafter, Kwesiga Raymond. So George, if you would like to go ahead with your comment, please go ahead. George, you are unmuted and we can hear your background. Whilst you sort that out, George, could we go to Kwesiga Raymond and I'll come back to you. Helen?
Okay, thank you. Thank you very much. Thank you very much for this. Is very, very, very important, and a lot of very many pertinent issues have been, raised. However, my comment here is
Kwesiga, I think we lost you. I don't know if it's just me, but we
the situation in our country.
Could you start?
Now people can no longer access.
Kwesiga, technology works sometimes and sometimes it does not. We cannot hear you. So are you able to type your comment?
Yeah, I'm hearing you.
Great. Could you try again? You're breaking up. Vicky, could I ask if you could intervene with George and Kwesiga because we're unable to hear them?
Sure. We need to see if there's anything in the chat from them.
George, do you want to try again? Because you are permitted to speak. Eric, you might want to give permission to the second George. Thank you. We'll give a few more seconds for this. George, are you able to speak now?
Yes, I can.
Please go ahead.
All right, thank you so much. I'm Asima George from Rural Aid Foundation, Uganda. I'm so privileged to be with you here today as we share the situation in which different countries, different civil society organizations are going through as in executing their work in different countries. For Rural Aid Foundation, work is turning out to be a bit challenging for us, but we shall adjust. We see right now there's no movement. Even when there's movement, you need to be, if it's a motorbike, you need to be riding your own self. There's no private vehicles moving. So it gets hard for us to do outreaches because there are no gatherings. It also gets hard for us to reach government offices because now the number of officials in the offices working has also been reduced to 10%. So it's a bit challenging for us, but we're also catching up. Regarding the vaccination, people have been vaccinated, but as one colleague of us said, people in rural areas are a bit reluctant to go and receive that jab. And also right now, even though they are reluctant, the doses were also not enough because they are given to a few selected people in the country, like the police, military, medical personnel. Yeah. So meaning the most vulnerable groups, so people like those living with HIV/AIDS, the elderly, they are still being left out. And we look forward to hearing from other groups that could also advise on how work is done and how it should be done by civil society organizations elsewhere. Thank you so much.
Thank you, George. Hearing your reality is very helpful, and I'm sure many of us were nodding our heads, understanding the challenges. There have been a lot of discussions and issues around COVID and HIV, particularly access to ARVs for those who do take them. So it's a dire situation, and really we hear the call of learning from others and others sharing, because we need to crowdsource solutions in many ways, because there's some structural issues that are just difficult, like 10% of the government workforce working, which has also had an impact on SRHR policy, where we're also seeing governments try to rush through policy because civil society is not able to organize in the way that it did before, because we were very dependent on physicality and we did not leverage virtual spaces. And so that's an area, as the Prof has talked about, that we do need to improve on. I want to give Kwesiga a chance again, because he did raise his hand. And as we said, we do want to hear your voices. So Kwesiga, are you there? A second or two to give you a chance. Eric, Kwesiga is on mute. You need to unmute him.
Yes, I have.
Thank you, Eric. Kwesiga,
am I in now?
Yes, we can hear you, but speak very quickly in case it goes again.
Okay. First of all, there's a big worry here, apparently, because for me, my niche is basically in HIV advocacy, and I'm very much worried. You know, we can no longer now cross from one district to another, and here quite a number of districts were broken from, a district is broken from a district, and you find that they're now a bit tiny, and a health facility that was taking, let's say, different patients from another is now cut off, and yet many are taking their medication from the other different districts. And now people are stopped from, moving, and those who try to move, like Prof said, there's a lot of militarization of COVID. A lot of military is everywhere, and as if COVID is a terrorist. So there's a lot of worry, and this is also very much compromising on the advocacy. The second issue of the vaccine, yes, even the few doses that are there, now that people cannot move, there's no transport. So if you need to move, you have to either walk. Actually, you need only to walk, because you can't go by taxi, you can't go by motorcycle, all those are completely banned. So for the next 42 days. So that's where the biggest worry is. And I wanted to ask Prof, in such a scenario, how could we, what sort of advocacy could we need to put in place to see that, though there's something already in pipeline, there's a paper which has been written by a group of persons living with HIV here in Uganda. And basically we are writing to the Prime Minister of Uganda to at least waiver, to at least let people access medication. And even if people showed their medical cards are not really, they are not helped, they are told go back. So yeah, that's what I wanted to share. However, thank you so much.
Kwesiga, it was great to hear your voice and fantastic that technology worked. A lot of interesting insights that you have shared with us. I'll hand over to the Prof and then to Vicky, and then we'll wrap up. Prof, over to you.
Thank you very much. I mean, I'll try and give a few of my thoughts. These are not, I would say, verified answers, but you get what you can from what I'm saying. So if I start from the last speaker, where limited movement, the delineation of districts has a direct impact on access to medication, especially for HIV persons. I think the history around this is very important because in advocacy, I always want us to look at the history of certain issues and how they've been dealt with in the past, and whether or not, we are seeing history repeating itself, and can we learn from something like that? So a couple of years back, we were looking at the state of migrants in Southern Africa and how when they get to retirement age and they go back to their own countries, depending on where they'll be working, let's say they are working in South Africa or in Botswana or wherever, when they go back to their countries, they would qualify for certain benefits, such as medication, insurance, the portability of their benefits, basically. But they couldn't do that very well because of the limitations around the jurisdictions. And so one of the big issues that we had to do some advocacy around was, for people who were had moved back to their countries, but were going back to South Africa and Botswana, for example, every month to collect their benefit, which included finances, some medical supplies, among others, was that if you come to South Africa and you are from Malawi or from Mozambique, and you come and collect your benefits, and part of that is medication on HIV and AIDS, upon crossing the border, the laws will immediately kick in terms of how much medication, in terms of drugs, so to speak, you can take outside the country. And because you are carrying a supply for the whole month, you would have exceeded the allowance that you should take across the border. And that became a big issue for migrant workers, especially those that needed medication, because it meant that they were only allowed to take a particular portion, but not the entire portion that they are supposed to have for the whole month. And this is important for me to say because it's exactly what is happening right now in most countries where provincial travel is limited, and where there's this scenario where your access to medication is in another district, but you live in a separate district, you're already affected. So some of the things that we could do, some are long-term, some are short-term. So from a short-term point of view, you are right that you need to do two things. One is you need to approach your courts as an advocacy organization or community. You need to approach your courts and litigate for access to medication during times of pandemics. And I don't know what the legal system there would say, but in most countries, access to basic rights like health, food, among others, are guaranteed even during times of a disaster. So you can go to your court, and a court can compel the government to allow some waiver and some access opportunities for medication. But that's a short-term I think advocacy approach. I think the long-term one is political, which is what we are talking about. Is this not an opportunity to look at the policies as well as the laws that some of which we inherited from our colonial masters, some were put in place by the current governments, but they put them merely drawing from what the colonial masters had put in place. Is this not an opportunity to actually repeal those laws by aligning them with the context and with the pandemic, and obviously thinking forward about what's yet to come? So I would see the political strategy as a long-term strategy. It involves developing new policies. It involves repealing what currently exists, but it also revolves around building a community, some kind of mobilized community around a demand for certain rights. And that won't come easy, like I said. So I give an example of 2 or 3 laws that were pushed by government in Zimbabwe during the pandemic. And if those laws were to go through, they were very detrimental to minority rights, to women, among others. But advocates during the pandemic used the opportunity to make use of social media, but also to use online campaign strategies in order to deal with this issue. So I think you can actually adopt online advocacy strategies in an environment where movement of people is actually limited. And that has proven to work both in North Africa, in Zimbabwe, and in other countries. So we might want to learn from some of those organizations that have managed to use online strategies as a form of advocacy. And that has actually worked. But I also think that in terms of long-term also, we need to be thinking about how to transport medication across districts. And I think a country like Rwanda, I think I heard somebody from Rwanda here, they might confirm this. And I think here in KwaZulu-Natal and others, where technology has been actually utilized to transport medication between rural districts using drones and other forms of new technologies. It sounds very fancy, but it's actually another way of thinking about how to actually mitigate and navigate against physicality. In this case, you are limited to travel, but drones are not limited to travel from one district to the other. Of course, you would say, but our countries don't have the infrastructure to actually facilitate that and so on. But we need to think of the impossible for something to actually come up. So I think those will be some of the comments that I would make. And I also think, George, your comments were also more or less very close to what I've just said. So I gave an example of online petitions, the use of social media, but also developing close working relations with some of the government departments, parliamentarians, and some ministries. What we saw during this time is that some ministries actually realized that they can benefit a lot by working very closely with civil society organizations who had the capacity to actually pivot to new ways of working. Governments are a huge bureaucracy, and so they are not able to move during this period. But when they work closely with some civil society organizations, they realize that they could actually still deliver services. And so they actually were open to collaborations, especially in some safe areas like water provision, which is very critical for purposes of dealing with COVID. So I think you can also look at that and also identify the means that government officials are at ease working with. So with technology, it's very confusing and very difficult for most people in government, but they are very familiar with certain aspects of what we call the low-level technology, your WhatsApp and others. In fact, a lot of work was done in other countries during the pandemic through things like WhatsApp between government officials and advocates. So we might want to look at some of those things that government officials are familiar with, work through that, but also take the opportunity to work with them and build their capacity so that we are able to benefit from their capacity as well. So these are some of my thoughts in terms of responding to your challenges, but certainly Uganda has entered a space where South Africa was last year and where other countries were last year. So there are many lessons that you can get from groups that are from these countries that worked like this before.
Thank you so much for that, Prof. Moyo. We are over time, so I would want us to close because we respect time. Just to share with you that Athanase, apologies if I'm saying it wrong, has concurred with your reference to drones in Rwanda, delivering not only essential drugs, but also to educate the communities about COVID-19. So a lot to learn. And I love your point that others have gone before us. Let's learn from what they've done. We don't have to always come up with new things, but we can really learn from others and replicate. I would want to hand over to Vicky, who is the convener of this cohort of alumni, and then I will quickly close by thanking you. So Vicky,
thank you. Thanks, Claire. 30 seconds. Just one thought. It might be worth looking at who is funding the rollout of the ARVs. And I mean, if it's Global Fund, for example, maybe to work with them and see if they can, you know, sort of put some pressure and enable cross-district movement around ARVs. So that's just a suggestion. It's been really nice having some of our alumni on the call. And I think that these are some discussions that we can take offline because we are obviously meeting regularly and having country conversations, which are coming up, which Ishtar is going to be facilitating. So maybe some of these issues can come up there. But thank you everyone for attending. It's been great. And over to you, Claire.
Thank you, Vicky. It is just left for me to thank you for attending the session. We love kudos, so feel free to also type in the chat your thanks. It is great to have a group of interested young people from different countries seriously considering the change agenda, transformation, and how we get there on the continent. It is also fantastic because, as Prof. Moyo has said, this is about trends which help us to do systems thinking, which is an area that advocates don't invest in. So we hope it's been helpful. Key takeaways from this is really, please look at the resources we've shared in the chat. We also shared with you the link to CAPSI's website. For those of you interested in philanthropy, indigenous ways of giving, go have a look, go look at their courses as well. And 2 big points from Prof. Moyo. One is learn from others. A lot has been done, so we don't have to go through the difficulty because others have gone before us. And then also the importance of friend raising, because we do want a robust civil society and advocacy ecosystem that is able to continue to hold the state accountable. So these different nuances are critically important. And lastly, to thank Prof. Moyo for doing this. It is always a joy to listen to you and to learn from you. And from the comments in the chat, people have really appreciated what you have come to share, your research and also your thoughts. So thank you very much for that. Thank you to Global Health Corps for setting up the partnership and also bringing us together. We look forward to continuing these conversations, not only in the program, but also in the webinars we have set up throughout the process as part of the methodology. So without further ado, thank you so much to all of you. Have a good afternoon or evening for those who are starting their day, those who are ending their day. Thank you so much, and we will see you at the next webinar. Thank you.